So welcome back. Today we'll discuss about the anatomy of the joints. Today we'll discuss about the anatomy of the joints. Okay. So in the last two classes, we have discussed about the skeletal system one and two. One was about the axial skeleton. Then in the lecture two, we discussed about the appendicular skeleton. Today we'll go further, and today we'll try to study the joints. These are the objectives, specific objectives related to this topic. So at the end of this lecture, you will be able to classify the body joints according to the structure and type of movement. So there is classification of joints depending on the structure as well as movement. So that we'll do. Then endless examples for different joints. Then understand the structure of the synovial joint, how exactly is the synovial joint. Then enumerate examples for different types of synovial joints, and then describe the body movement elicited at each joint type. Okay, so these are the specific objectives. So before we study the joints in detail, we should know what exactly is joint. So it is defined as a site where two or more bones come together. So when two or bones articulate with each other, when they come close to each other and articulate, okay, then it is called as a joint. So sometimes there can be movement and sometimes there is no movement. Okay, whether or not movement occurs between them. It is not necessary that there should be movement, only then we call it as joint. Okay, so always the joint will be the site where two bones come in contact with each other. So sometimes there can be movement, most of the time there will be movement, but sometimes there will be absence of movement also. Still we call it as a joint. Okay, so joint is a site where two or more bones come together whether or not movements occur between them. Okay, now coming to the classification of joints. What exactly is the classification of joint? Okay, so this classification is divided into two types. One is according to the type of movement. Okay, and the second classification is according to the structure of the joint, the tissues that lie between the bones. Okay, so these are the two types of classification of joint. One is depending on the movement, and the second is depending on the structure. So we'll study what is the classification depending on its movement. Okay, the first one is called as the synarthrosis. Synarthrosis. Depending on the type of movement, there is synarthrosis, means immobile joint. So there are no movements. Okay, so such kind of joints are called as immobile joints, are called as the synarthrosis. Arthro means the joint. Okay, synarthrosis. So the best example for this kind of joint is sutures in the skull. When the skull bones come in contact, there are also joints, but there are no movements at the skull. Okay, so such kind of joints are called as the synarthrosis. The best example for this is these sutures. The second type, depending on the movement, is the amphiarthrosis. Amphiarthrosis, synarthrosis, amphiarthrosis, and then diarthrosis. So what is amphiarthrosis? Slight movable joint. So here in synarthrosis there is no movement, total absence of movement. So the such are called as the synarthrosis. Slight movements, then it is called as the amphiarthrosis. So the best example is intervertebral joints. Intervertebral joints. The third type of joints, depending on the type of movement, is the diarthrosis, where there is freely mobile joint. So where there are easy movements without any obstruction. The best examples will be the shoulder joint, knee joint, elbow joint, the hip joint, the ankle joint, wrist joint, all the joints where there are movements, easy movements. Such kind of joints are called as the diarthrosis. So depending on the movement, so there are three types: synarthrosis, amphiarthrosis, and diarthrosis. Synarthrosis means there are no movements. The best example is sutures. The amphiarthrosis, slight movements are there. Those are called as the example for this is intervertebral disc or the intervertebral joints. Between the two vertebrae, there are slight movements where there is the intervertebral disc is present. So such kind of joints are called as the intervertebral joints are called as amphiarthrosis, where there is slight movement. The third type is freely mobile joints, which are called as diarthrosis, and the best examples are the shoulder and the knee joint. So this is the one type of classification depending on the movement. Now the second classification is depending on the structure, okay, of the joint, the tissues that lie between the bones, Okay, the first type of joint is fibrous joint, where there is a fibrous tissue between the bones, such are called as the fibrous joint. Then we have the cartilaginous joint. Then we have the synovial joint, where there is a cartilage between the bones, then it's called as cartilaginous joint. Where there is synovial fluid, such kind of joints are called as synovial joints. We'll go into detail about all these things. Fibrous joint, cartilaginous joint, and synovial joint. These are the three types of joints depending on the structure. So these are the main two types of classification of the joints. Now coming to the this depending on the structure, we'll talk about this structure depending on the structure, the types of joint, that is the fibrous joint, cartilaginous joint, and synovial joint. The fibrous joint, this is the fibrous joint here. So if you the best example, as I said before, is for fibrous joint is also sutures. So there can be both. It can be depending on the movement, then it will belong to the synarthrosis. And if you want to see the structure in between the fibrous joint, so there is fibrous tissue. If you see here, the yellowish, these are the fibrous tissue within the suture. These zigzag lines are called as sutures between the two bones. So these are called as parietal bones. Then we have the frontal bone as well as the lambdoid bone. Okay, so this between the skull bones there are joints. These are called as sutures, and within the suture there is a yellowish structure. This is the fibrous tissue. So that's what is called as fibrous joint. This is the immobile joint, if you want to classify under the movement. Okay, but we are dealing with the structural feature. Okay, so the first example is the fibrous joint. This is the fibrous joint. The articular surface of the bones are joined by fibrous tissue. So there is thin layer of fibrous tissue in between the two bones. So such kind of joints are called as fibrous joint. So there are no movements are allowed in this type of joint. So as you know, in the skull bones there are no movements. Okay, so still they are called as joint. Even though there are no movement, they are called as joint. So there are no movements allowed in this type of joint. Lack of joint cavity. There is no space cavity. Later we'll see there is a big cavity filled with synovial fluid. In case of synovial joint, there will be a cavity. But here there is no cavity, no space. Okay. So these are the fibrous joints. Okay. The types of fibrous joints, again, depending within the fibrous joint, there are different types. Sutures, gymphosis, and syndesmosis. Sutures, gymphosis, and syndesmosis within the fibrous joint. Okay. So the first type of joint, fibrous joint, that is the sutures. As we already seen, these are the sutures. Okay. Sutures as the sutures of the vault of the skull. Then what is gymphosis and syndesmosis? So if you see here, gymphosis, contact between the root of the teeth and the sockets in mandible and maxilla. So if you see here, this joint here between the teeth and the socket within the mandible or the maxilla. So this joint is called as the gymphosis. There is a joint between the teeth and its socket, the space here within the bone, okay, which are fixed. So this is called as the gymphosis joint. Then we have the syndesmosis as the inferior tibialofibular joint between the tibia. We have seen the bones, these bones in the leg. Okay, so there will be a large bone called as tibia and a narrow, thin, narrow bone called as the fibula. In between them, again there is a fibrous tissue, and this joint is called as the syndesmosis. So these are the three types of fibrous joint. Within the fibrous joint, we have three types. One is the sutures, as we have seen the example here. Then we have the gymphosis in the tooth and the socket, and the syndesmosis in the inferior tibialofibular joint. Okay. So these are the three types of fibrous joint. Now we'll go to the second type, that is the cartilaginous joint. So first is the fibrous joint here. Then we are going to the cartilaginous joint. Then we'll study about the synovial joint. Right now we are studying the cartilaginous joint. Okay, coming to the cartilaginous joint. So again, here also there is no cavity, joint cavity, lack of a joint cavity. Just like in case of the fibrous joint, even in the cartilaginous joint there is lack of joint cavity. So there is no cavity. Allows little or no movement. So here in cartilaginous joint there are slight movements or sometimes even absence of movements. Okay. It can be divided into two types. One is the primary cartilaginous joint and the second type is the secondary cartilaginous joint. These are two types of cartilaginous joint. So fibrous joint are divided into three types and the cartilaginous joints are divided into two types. One is the primary cartilaginous joint and the second is the secondary cartilaginous joint. Okay. The primary cartilaginous joint, the bones are united by a plate of hyaline cartilage. So here there is a plate of hyaline cartilage. Okay, so here there are no movements is visible in this joint. If you see here, so this is the manibrum sternum. This is the sternum. Here is the manibrum body of the sternum support process. Between the mandible, the sternum and the ribs, there is a cartilage. This blue structure here. This is the hyaline cartilage. So this is hyaline cartilage. So this is called as the the cartilage here, costal cartilage. It has a specific name called as costa. Costa means rib. The cartilage which is attached to the rib, that is called as costal cartilage. So these blue colored structures, these are the cartilages. So this is one of the example for the cartilage joint between the sternum and the ribs. This joint is called as the primary cartilage joint. Okay. The union between the epiphysis and the diaphysis. Also here, if you see here, this is a long bone. There are different parts for the bone in development. The terminal part is called as epiphysis and the middle shaft is called as the diaphysis. So these epiphysis and diaphysis, initially during children, it will be separate. It will separate. Later they fuse. Okay. Before they fuse, there is formation of a cartilage here. If you see here, this is the hyaline cartilage between the epiphysis and diaphysis. Later it becomes bone. Okay. So the union between the epiphysis and diaphysis of a growing bone. In case of children, it is growing. Okay. So the epiphysis and this diaphysis. In between there is cartilaginous joint. Between the first rib and the manibrum sterni. So there is between the first rib. This is the first rib here and the manibrum sterni. This part. So this is also the cartilaginous joint, primary cartilaginous joint. Now going to the secondary cartilaginous joint. Within the cartilaginous joint, there are two types, as I said, primary and secondary. So what is secondary? The bones are united by a plate of fibrocartilage. Instead of just the cartilage, here it is hyaline cartilage. Okay, and there are no movements possible in the primary cartilage. What is the difference? In the primary cartilage joint, there are no movements and the cartilage will be hyaline cartilage. In case of secondary cartilage, it is fibrocartilage. Fibrocartilage, you see here. So here you can see fibrocartilage. Here also you can see fibrocartilage. Okay, and a small amount of movement is possible. Some amount of movements are possible in these kinds of joints. Okay, these are called as secondary cartilaginous joint. Examples are joints between the vertebral bodies, and the symphysis pubis, between the two pubic bones or the hip bones. There is these two bones are joined together in the center. Okay, so these are the cartilage joint. Usually, these cartilage joint will be in the center of the body. So these also will be above here. Okay, between the vertebrae. So it is also in the midline of the body, as well as the pubic symphysis that is also in the midline. Okay, so these are the examples for the secondary cartilage joint. One is the pubic symphysis as well as joint between the vertebrae. Okay, so these are the cartilage joint. Now going to the third type and the most important type, that is the synovial joint. Synovial joint. Now coming to the synovial joint, what exactly is the synovial joint and what are the features which make it synovial joint? How do you identify whether it is a synovial joint or not? The first characteristic feature of the synovial joint is there is articular or hyaline cartilage, just like that of the cartilaginous joint. Here also there is hyaline cartilage. But remember, there are other features also along apart from that. There is articular or hyaline cartilage. If you see here, so this is the two bones are coming in contact, and this is called as the joint. And if you see the part which is in contact with each other, so that is covered by a cartilage. This is called as articular cartilage. Here also you can see here two bones coming in contact, not directly by but covered by cartilage called as the articular cartilage, or it is also it is made of hyaline cartilage. So that's why it is called as hyaline cartilage or articular cartilage. The part of the bones which are in contact are always covered by hyaline cartilage. If you see in synovial joint, always the two articulating surface will be always covered by the articular cartilage. Second is there will be a capsule. The joint is surrounded by a sleeve of fibrous tissue which holds the bones together. Here there is fibrous tissue, but not in the between, but it will be outside here. There is a fibrous capsule. This is called as the fibrous capsule outside, this pinkish structure, fibrous capsule. Okay. So here is the pinkish structure called as fibrous capsule outside, which is made up of fibrous tissue, and the two bones will come in contact with each other covered by hyaline cartilage. Okay, so this is the second point. The third point is very important point, because of which it is called a synovial joint, is the synovial membrane. Synovial membrane as well as the synovial fluid. Synovial membrane, this is composed of the epithelial cells and is found lining the capsule. If you see here inside, this is the capsule as this side. Inside the capsule, it is lined by a thin membrane called as the synovial membrane. Inside there will be synovial membrane. So fibrous capsule outside, and inside there will be, it is lined by synovial membrane. That's why it is called as synovial joint, because it is lined by synovial membrane, and this synovial membrane will secrete a fluid called as synovial fluid. The covering parts of the bones within the joint are not covered by articular cartilage. The covering parts of the bones within the joint, if you see here, so only the part which is in coming in contact with each other is covered by the hyaline cartilage. All remaining part is covered by the synovial membrane. Not only the inner side of the capsule, but also even the bone which is not in contact. So that is also covered by the synovial membrane. So it is covering part of the bones within the joint, not covered by the articular cartilage. Which is not covered by articular cartilage will be lined by the synovial membrane. Covering all intracapsular structures that do not bear weight. So any other structure, if it is there, that is also covered by a synovial membrane. But the thing is, they should not bear weight. So these are the three features. What are the three features? One is the hyaline cartilage or the articular cartilage, which covers the articular surface of the bone. Second is the synovial membrane. The fibrous capsule. Second is the fibrous capsule. Sorry. So fibrous capsule will be there, which will be putting the two bones together. Okay, and it is lined from inside by the synovial membrane. So synovial membrane will be inside, and this synovial membrane will secrete a fluid called a synovial fluid, which will freely move through this cavity, and it gives free lubricated movements. Okay, and it also, this membrane also covers any intracapsular structure if it is there. Okay, so these are some of the features of the synovial membrane. One is the hyaline cartilage or articular cartilage. Second is capsule. The third is the synovial membrane and synovial fluid. So synovial fluid. This fluid is secreted by the synovial membrane. As I said before, this membrane which is lying from inside, so that is secreting fluid called as the synovial fluid. Okay. So what is the specialty of the synovial fluid? It contains phagocytes which remove microbes and cellular debris. Why they are present? Because they fight against any bacteria or viruses, any microbes, as well as any damage cellular debris will be all eaten up by these phagocytes. Okay. The third is it acts as a lubricant. The synovial fluid, why it is present? Because it acts like a lubricant, just like we put oils in the machines for free lubrication. Similarly, in joints, God has put the free lubricant into our joints, which gives free and frictionless movement. The fourth is it prevents the ends of the bone from being separated. So this fluid also creates a negative pressure which will pull the bones together, keep always these bones together. Okay, so these are some of the features of the synovial fluid. Synovial fluid secreted by synovial membrane, and it contains phagocytes which will engulf all the microbes and cellular debris. Then the synovial fluid also acts as a lubricant for frictionless movement as well as prevents ends of the bone from being separated. So these are some of the features of the synovial fluid. The fifth is extracapsular structures. So there are some structures which are outside the capsule. These are ligaments and muscles. Ligaments provide additional stability at the most joints. If you see all the bones, these bones can get separated. So they are pulled and kept together by a fibrous ligament outside. There is a ligament outside. This is a fibrous ligament which will pull the bones together and keep it together intact. Okay, so these are called as ligaments. Okay, and the muscles are the tendons. Muscles also will be outside the capsule. Always remember, it is not outside. The ligament is outside the capsule as well as the muscles are outside. This is the capsule here. Okay, so outside the capsule is the ligament as well as the muscles. So these are called as extracapsular structures. Okay, now coming to the types of synovial joints. Types of now synovial joints we know, so which is lined by synovial membrane, which contains synovial fluid, which will be covered by the hyaline cartilage, and it will be having the this capsule. Okay, so these are some of the features of the synovial joints. Okay, now coming to the types of synovial joint. The first is called as hinge joint. Hinge joint. Okay. So hinge, it looks like a hinge. You know the hinge. Hinge is that structure which keeps the doors intact. When you open and close the door is closed and open. There is an angulation that is called as hinge. Okay. Similarly, here also the joints move in similar fashion in unidirectional movement. So that is called as hinge joint. Hinge joint resembles the hinge on a door. Okay. So that's what is called as the hinge joint. Flexion and extension are the two movements which are possible at this joint. So this is the best example is the elbow joint here. So if you remember, there is flexion as well as extension. Flexion, extension. This is the humerus, and this is the bone of the arm, and these are the bones of the forearm, radius and ulna. So when they move up, then it is called as flexion. When it moves opposite, then it is called as extension. So flexion and extension movements are possible at the only two movements at this joint. Okay, so these are the flexion and extension. The examples, best example for these joints are the elbow joint as shown here. This is the elbow joint. Then the knee joint also as well as the ankle joint. These are the examples of the hinge type of joint, just like the hinge of a door, which will help in opening and closing of the door. The second type of joint, synovial joint, is the pivot joint. Pivot joint. Okay. So this is specially seen in case of the first and the second rib. The first rib is the atlas. The second rib is the axis. This is called as axis because it has a dent here. Oh, so this long process, okay, this is called as the odontoid process, so which will act as the axis for the first vertebra. So the first vertebra will rotate like this in this direction. Okay, on the second vertebra. This is the second cervical vertebra. This is the first cervical vertebra. This is the first cervical vertebra called atlas, and the second cervical vertebra called as the axis. So this on the axis, the first vertebra will move side to side, which helps in saying no, no. Okay. So that movement is done by this two bones. So this joint is called as the pivot joint. A central bony pivot is surrounded by a bony ligamentous ring. This is a ligamentous ring around the first atlas, and this will move around this the pivot. Rotation is the only possible movement. Okay, so rotation, like as I said, no movement in the head is done by this joint. Okay, the atlantoaxial and the superior radioulnar joint are the good example. The atlanto, this is the atlas, so this is called atlanto. This is the axis, so it is called axial. Atlantoaxial, this joint is called as between the first cervical and second cervical rib. The joint is called as the atlantoaxial joint, as well as the superior radioulnar joint. If you see here, between these two bones, radius and ulnar, there are movements. Okay, which helps in the pronation and supination. Not this movement here, flexion extension. This is for the hinge joint, but between this only these two bones, there are some movements which help in the pronation and supination. So that's why that is called as, these are the examples of the pivot joint. One is the atlantoaxial joint and the superior radioulnar joint. Third type of joint is called as the condyloid joint. Condyloid joint. Okay. Two distinct convex surfaces that articulate with two concave surfaces. Two convex surfaces will be there. So two cavities will convex. These are the convex, and this is called as concave. So this, in this joint there will be two parts of this bone which will be articulating on two parts on this bone. Okay, this will be concave and this will be convex. So such kind of joints are called as the condyloid joint. Two distinct convex surfaces that articulates with two concave surfaces. Like here you can see only one, but there will be two. So two cavities will be there and two convexes will be there. So they will articulate with each other. Okay, so this type of joint is called as the condyloid joint. Okay, two distinct convex surfaces that articulate with two concave surfaces. The movements taking place will be, one is the flexion extension and abduction and reductions are possible. One is the flexion movement here. As you can see, this is the metacarpophalangeal joint, the hand. So this is called as flexion, and there is opposite movement is called as extension. Okay, then these two movements, one is called as abduction and the second is called as adduction. So these movements will be also called, there are four movements here. In the previous joint we had only two movements. In the pivot joint there was only rotation, and in the hinge joint there was only flexion and extension. But here in the condyloid joint there are flexion, extension, abduction and adduction. This is the flexion, as I said. Opposite movement is the extension, and here the abduction and adduction. Okay. Example is the metacarpophalangeal joint. Metacarpophalangeal joint. So this is the metacarpo and the phalanx. So metacarpophalangeal joint is called as the condyloid joint. Then the fourth type of synovial joint is called as the ellipsoid joint. Ellipsoid joint. An ellipsoid convex articular surface fits into an ellipsoid concave articular surface. So here also there is a convex as well as a concave surface which will be articulating with each other. There are movements taking place at the flexion, extension, abduction and reduction. So there are four movements here also. So this flexion, extension, abduction, reduction. And the best example is the synovial joint. Is a good example. Synovial joint, wrist joint. Sorry. Wrist type of synovial joint. So where is the wrist joint? This one is the wrist joint between the radius and the carpal bones. Radius and the carpal bones. So this joint is called as the ellipsoid joint. One is concave and the other is convex. Then the best example for the synovial joint is the ball and socket type of joint. Ball and socket. Okay. So the ball head shape of one bone fits into socket of another type. So the best example is the shoulder joint and the hip joint. So this is the hip joint. Here the head of the femur, which is the ball, it looks like a ball here, and fits into the hip bone where there is a socket. So that is called as the So this is the socket here. So the one head of one bone will shift into the socket of the another. So similarly, the head of the humerus will shift into the glenoid cavity of the scapula in case of the shoulder joint. So these are called as the ball and socket. So this is the ball and this is the socket where it will fit. Okay, the ball shaped head of one bone fits into socket of another. So here there are free movements. Lot of movements can take place. Ball and socket type is a very good example for lot of movements, including flexion, extension, abduction, adduction, medial rotation, lateral rotation, and the circumduction. This circumduction is a combination of all these movements that is called as circumduction. Okay. In the practical session, uh, try to practice these movements: flexion, extension, abduction, adduction, medial rotation, lateral rotation, and circumduction. Okay, so this is very important for you to know the movements at different joints. Example, as we said, is the shoulder joint as well as the hip joint. This is the hip joint showing and the shoulder joint. Best example for the ball and socket type. Then there is also other type. One is called as the saddle type. This is the sixth type of joint. Sixth. This is called as the saddle joint. The articular surface are reciprocally concavo-convex. Concavo-convex. Okay. So the articular surface, one is the convex surface and the other is concave surface. So the articular surface are reciprocally concavo-convex. So whenever this is convex, this becomes concave. When this becomes concave, this becomes convex. Okay, like that. Okay. So here also there will be a lot of movements like flexion, extension, abduction, adduction, and rotations are permitted at this moment also at this joint. The carpometacarpal joint of the thumb is good example. If you know, the thumb is quite movable, and that is the example for the saddle type of joint. Okay. Then we have one more type here. This is called as plane joint. Plane joint. Okay. So the opposed articular surface are flat, as the name indicates plane. So they are flat or almost plane structures. Okay, the bones slide on one another. The example of this joint are the acromioclavicular joint. Acromio. So here you can see this is the acromion part and this is the clavicle. So if you see both the surfaces of both the ends, they are flat. The best example is the acromioclavicular joint, as well as the intercarpal joints between the carpal bones. We have seen the carpal bones here. These are the carpal bones. In between the carpal bones, so there is articulation. This is also the plane type of joint, plane joint. Okay, plane joint. So the best example is the acromioclavicular. This is the acromion process of the scapula, and this is the acromion end of the clavicle. So they articulate, and both the surfaces, if you see, they are flat. So that's what is called as plane joint or flat joint. Okay. Now coming to the all these type of the joint, that is the diarthrosis. Diarthrosis where there is free movements. Okay, so we have already seen a lot of joints of this type, synovial joints of the diarthrosis. The example, one is the ball and socket type in the shoulder joint, as we saw, the shoulder joint as well as in the hip joint. So one is the ball, the head of the humerus here is the ball, just like a ball here, and there is socket on the other side. So this is the ball and socket type. The example is the humeroscapular joint or the shoulder joint. Okay. Then we have the hinge joint. Hinge joint. The elbow joint is a very good example of the hinge joint. Humero-ulnar joint. This is the humerus as well as the ulna. Between the humerus and ulna, there is a joint. This is called as the hinge type of joint. Okay, which move only in one direction, just like the hinge of the door. This is the hinge type. One is the socket, one is the this type of joint. So this is called a hinge joint. Okay. Then we have the saddle joint. If you see here, one is conveco-convex and and the other is convexo-concave. Depending on how this bone is there, the opposite will be the direction of this bone. Okay, this is called a saddle type of joint. Carpometacarpal joint. Carpometacarpal is here between the carpal bones and the metacarpal. The best example is the thumb. Okay. Now coming to other types of joint, like the pivot joint. Pivot joint between the radius and the ulna. Between the radius and the ulna. So this is how they will look like. The head of the radius will move into the socket of the ulna when there is pronation and supination. This is called as pivot joint. Then we have the gliding joint between the carpal bones. There is gliding movement. Okay, that is we call it as the flat joint or the plane joint. Okay, it is also called as the gliding joint. Then we have the condylite joint between the metacarpophalangeal joint, which you see here. So metacarpophalangeal joint. This is called as the condylite joint. So these are all the types of joints which we have. Okay, the fibrous joint. Within that there are three types of joint. Then we studied the cartilaginous joint where there are two types, primary and secondary. Then we studied the synovial joints which are of many types. Okay. So now coming to the clinical aspect, how this is important, how this knowledge will help us. The clinical aspects, okay, the knowledge about the classification of joint is of great value because certain diseases affect only certain types of joint. So this is important because there are diseases which are specific to some joints, okay, some types of joint. So if you know the disease, then you also can trace where exactly it will affect. Or if you know the joint which is affected, then you can easily diagnose the disease also. Like the gonococcal arthritis affects large joints such as the ankle, elbow, or the heel joint. Okay, gonococcal arthritis affects large type of joints like the elbow, ankle, as well as the wrist. Then there are tuberculous arthritis. The tuberculosis affecting the joint. Also, it not only the tuberculosis not only affect the lungs, but also it can affect other organs, including the bones and the joints. So if it includes the joint, then it is called as the tuberculous arthritis. This will affect synovial joint and may start in the synovial membrane or in the bone. As I said, it might start in the bone, then it can go to the joint and it can affect the joint. So this type of joints are very important. One is to know the movements as well as clinically they are important because specific joints are related to specific diseases. So this knowledge of the types of joint and their movements all will help in your diagnosis. So this is all about this lecture. If you have any doubts regarding this, you can ask me now.